Now, when you heard about
Well, welcome. Good morning. I'm Mike Wilson. I'm the Southwest Michigan Regional Coordinator for Michigan Veteran Affairs Agency, and I'm glad to see you all here. I represent the Southwest Michigan Veteran Community Action Team, Healthcare Subcommittee. That's a lot of stuff, and I'll explain that here in just a minute. Let's do the next slide. Let's get these. Oh, I got to click. Change. All right. So first of all, housekeeping, the restrooms. Ladies' room is out that door and down the hallway to the right. Men's room is either doorway of the hallway to the left. Emergency exits to the rear in the unfortunate event. What else will you got? There is vending machines. If there was nothing you like to drink in the barrel outside, there's vending machines past the ladies' room on the right if you want to step off. We got a very tight schedule, and so feel free to jump off, walk out, go to the restroom, go back and forth. We will have a break. We're about noon, I think. We'll have a break, so if you hold out that long, that's great, but don't feel bad if you want to get up and step out. If you do, grab lunch if you want to grab lunch. So please do. So with that, this is a no smoking campus, so if you need to smoke, have a, I'm sorry. Former smokers, I get it. So, you notice in front of you there's 3x5 cards, and there was 8 pens if you didn't have an 8 pen, you could grab an 8 pen at some point. There's 2 presentations, they're each about 20 or 25 minutes a piece, and it's going to might get a little bit confusing. So versus raising your hand and asking the question and slowing down the presenter, we would ask that you write the question down on this 3x5 card. And as you write it down, my good buddy Nick over here from the VA may or may not take that from you. You can hold it up, build it up again. Otherwise, he'll collect them at the 10-minute break. And we'll ask those questions so the panel is also available to help answer those questions. Some questions lead to other questions, and that's how we'll handle the panel discussion. So Nick has pens and 3x5 cards. If you didn't have some set in front of you, please grab them. There will be time at the end. If I know I'm the kind of person that won't ask a stupid question. I'll wait until the end and run the person down and ask a stupid question directly to them. So if you're that kind of person, or if you have something more personal you want to ask, I believe all presenters will stick around. There's time for networking at the end. I don't think KVCC is throwing us right out at 1 o'clock. So there'll be time for networking. I'm going to do enough time. They gave me 5 minutes. Here we go. So the VCAT. Michigan Veteran Affairs Agency is only about 4 years old. We were established in 2013 when the governor realized that Michigan was 53 out of 53 states and territories for federal dollars coming to the state to support veterans. And so he established this Michigan Veteran Affairs Agency, and from there grew into this regional coordinator program. There's one of us in each region. I cover Southwest Michigan, or region. So altogether in the VCAT, there's 2,400 resources. Right here in Region 8, I have a collection of about 310 resources for veterans. We work as a no wrong door approach, warm handoff. I work with the VA, I work with veteran service officers. If I'm approached or if they're approached and we know that each other has a resource, we literally hand it off. We don't just hand off phone number, we hand off. Veterans work in conjunction with Veteran Resource Service Center. The Michigan Veteran Affairs Agency has a 1-800 phone number. You grab one of the numbers over here. It's 1-800-MISH-VET. If you have veterans in your organizations or agencies and you don't know how to help them, you could have them call that number, or you can call that number for them. Most likely, you'll be rerouted right back to Southwest Michigan to either a veteran service officer or someone else in the region. But that's a good number to start with, Veteran Resource Service. So, we utilize Podio. It's Facebook for service providers. Has anybody ever heard of Podio? Podio is a program that it's like Facebook. You have to register and become a member. It's private. If you have a veteran in your area, your agency, and you don't know how to support them, you can simply go on Podio and write, I'm a veteran, you'll use the name, your social security numbers that has this issue. And there's some agency out there that will jump on that to help you fix that problem. So if you want to be a part of Podio, make sure you grab one of my cards before you leave, send me an email. We work under 4 pillars. Because our organization is so large, 307-county region, we've broken it down into 4 pillars. The MVAA runs on employment, education, healthcare, and quality of life. This happens to be the healthcare subcommittee's first out of the chute activity that we're doing. And we have the other 3 pillars. If you're interested in knowing more about the other 3 pillars, again, my card, I'll be glad to share information with you by email. It's about 5 minutes. Okay, again, there's the VCAT regions. If you have other people in your organization outside our region and you'd like contact those folks, my card. With that, I'm going to turn it over to Matt Newman from the VA, and he'll begin the presentation.
All right, can everybody hear me all right?
Yes.
Good? Yeah. All right, so my name is Matt Newman. I'm with the Battlefield VA Healthcare Delivery System. I'm actually, let me try and turn it off and see it. All right, can everybody still hear me all right?
Yes.
All right, sounds good. We'll do it the old-fashioned way. I'll take on my old command voice for my military days. So. All right, my name is Matt Newman. I'm with the Battlefield VA Healthcare Delivery System. I'm right now actually the acting associate director for our healthcare system for a few more weeks until our director, Dr. Subcommittee, comes back and I move back to my regular role as a health system specialist to the director. So today I'm going to go over some slides. There's a lot of slides here. We're going to make sure that we make these available to you afterwards. So if there's things that I glance over, you may want some of these resources, but we'll make sure they're available electronically for you to get. But really the intent is, to go over who we are as VA, to share a little bit of that, what we do and how we're structured, and then some overview of the Battle Creek VA in general. So first of all, it's great to see so many new faces. I go to a lot of community events and I see a lot of new faces out there. So that's really good because partnerships are key to our success as serving veterans. Not just VA, but us as a community, and that's what this is all about. This is about community coming together to serve veterans. So if I could just real quick, can I get a show of hands of how many folks in here are from a VSO organization, Veteran Service Organization, whether it's county or one of the other? Great, all right, thank you. How about any VA employees, federal VA employees? All right, great. How about community mental health? All right, great. How about community hospital or healthcare system? Wonderful. All right. How about aging network or senior services? Great. Any home health care agencies? All right. Awesome. How about state agency employees? Wonderful. And then how about any other community or nonprofits out there? Great. Is there anybody I missed going down that list that doesn't fit into any of those? All right, Ira, where are you from? I just got to know.
Both of us are from, we're service coordinators at Westland Meadows, which is a housing.
Okay, so housing and resources. Great. Great. Okay.
Disabilities.
Wonderful. Okay, great, awesome. Any other private practice out there? Oh, great. Well, thank you for being here. And I think that's really awesome to see that this collection of different folks with different missions coming together. So first, just a little bit, we're going to go into the overview of VA in its entirety first. This is we call our core values, our HealthcareVCAT values. I'm not going to go through it all. You guys can read it and come back to it, but I think there's stuff you would like me to spend more time on than just that. But these are our core values across all of our services. So what makes VA special? I don't know how familiar you all are with VA and our history, but VA has a very long history of research and innovation, come up with a lot of great medical advances over the years in VA. There's a few bullets up here of things. You know, one of the most recent things that's come out is in the Journal of Medicine, VA was just noted for meeting or exceeding all community standards for customer satisfaction. And you hear a lot of negative about VA in the press right now, but that's an independent review and came out, and actually in 4 of the 6 measures, VA exceeded community standards, and in the other 2, we were on par with community hospitals. We have a lot of cutting-edge technology. I don't know if many of you knew, but VA was the first to use electronic medical record. We really were the ones that developed that, and then it spread. We're getting ready right now. The Secretary just announced plans to upgrade that and come in line with the DoD program for the EMR. So that'll be nice so those things can talk. There's a lot of things we're really pioneering. CVT, the Clinical Video Telehealth program, big focus on that and reaching out to our rural areas. You know, there's many things, lots of mobile apps. We just launched a new mobile app where veterans can go on and schedule their appointments. They don't have to call in, they can schedule via an app, and that will continue to roll out through 2 different services throughout the VA. So there's a lot that goes on. We've gone to really in the past year and a half or so to more automation, kiosks for check-in, for looking up appointments and such. So lots of stuff going on there. So our team. This is one thing that really makes us special, I think. This is a pretty neat slide. So we have about 340,000 employees in VA. Over 30% of them are veterans too. So you know, we really focus on veterans serving veterans. The projected U.S. Population of veterans out there is about 22.2 million. So that's 22.2 million potential customers that we have out there. And what we do in VA, you really have to think bigger picture with that. And this slide really illustrates that. So all of those jobs up there are available within VA. So you think of a regular community, and pretty much any job that there is in the community, we have in VA. It's pretty robust organization. So who do we serve? So obviously veterans are our customer. We have about 9 million nationwide, 9 million veterans enrolled in our healthcare system. The largest healthcare system in the world, 9 million veterans. This is really the breakdown. You kind of see the world wars. Those veterans are, you know, very aged now, and we're seeing fewer and fewer of those. As well as Korea, Vietnam, we're seeing a lot of Vietnam-era veterans. The Gulf Wars, and then obviously the newer global war on terror, the Iraq, Afghanistan veterans were serving. So, and it's pretty interesting is that a lot of veterans don't consider themselves veterans if they never served in a conflict. But there's 5.5 million peacetime veterans out there that may not even consider themselves a veteran, but they may be eligible for services through the VA depending on their period of service, how long they served, and a lot of things there. So, big point. We do take care of dependents as well. So there are certain veteran spouses, children that are eligible for services, so it's not just the veteran. We also serve quite a few active service members as well. So there's DoD VA partnerships out there that we can do. So not as big in this area because there's not as many active duty, but across the nation there's more that are served. So services and benefits. It's important to understand how the VA is structured. So we have our VA central office, and then we have our 3 branches of VA. So we have the Veterans Benefits Administration, we have the Veterans Health Administration, which the folks in here, is anybody VA in here from VA? No, it's the Vet Center and VHA here, well, Vet Center's part of VHA. But then the National Cemetery, so you think of Fort Custer National Cemetery, they actually fall under the Department of Veterans Affairs as well. Real quick, I'm going to go through a few things that each of these do because it's important to understand the difference. So you're not sending veterans to the wrong place for the wrong services, all right? So on VBA, it's important to understand they handle all the benefit stuff. They're the GI Bill stuff. They're the education benefits, the housing benefits. They do the compensation claims. So even if you're filing for service-connected injuries, the veteran goes through the VBA first for a determination before they come to VHA. We partner with them by doing the exams, but VBA is the one that does that disability determination and any compensation that goes along with it. Very important to distinguish. Somebody's not coming to the Battle Creek VA and walking away with a service-connected determination. That's going through VBA. They'll get notified through that channel. All right? That's probably one of our biggest areas of confusion. So these I'm just going to briefly highlight. You'll be able to get these when you get a copy of the slides, but you can find out or refer veterans to this website, this phone number, one of our booklets on how to find out if they're eligible for service. And Amy's going to talk more about eligibility. And also filing a claim, they can do it through those. But those veteran service officers that raise their hands out there, they are going to be your best referral source if you run into a veteran that needs to file a claim. They are the experts in how to do that, and we'll walk them through step by step, hold their hand through the process, make sure they get everything up front so they have the biggest success of getting their claims through. National Cemetery, so we provide burial benefits for veterans. There's some new stuff now that you can actually get. Does everybody know what a DD-214 is? Before I start throwing slang out there. So your discharge paperwork, so it tells you your character discharge, whether it was honorable or not, where you served, if you're a combat veteran, all your awards, all that stuff's on there. If you're working with a veteran, make sure that you know where that is and have it. That's like the holy grail for a veteran. You want to have that. All right. But all they have to do is bring that to the NCA, Fort Custer over there, and they can help them prearrange burial benefits as well. So that's spouses can be buried with the veterans as well in NCA. And I'm not going to hit too much on this, but again, you can go on to the National Cemetery website. It will walk you through exactly what you need to do. It's very user-friendly. National Cemetery has received awards throughout the years as for their customer focus. They have far surpassed out there and have been acknowledged among many private companies as providing outstanding customer service. So in VHA, so Veterans Health Administration, those of us working here, there's quite a few things that we offer and some highlights here that you can read. I'm not going to read them to you, but hit on the Women Veterans Call Center. That's a population that we are really trying to reach out to and engage because female veterans, that population is growing and continues to be underserved. And we do have women's services that people do not think about. So we do have a women's health program that for eligible veterans. Veteran centers, VA services. So pretty much we offer it. If you can think of it, we offer it. If we don't offer it within VA, we have a non-VA care program or care in the community program, and chances are that it's offered through one of those programs. So our vet centers, this is a special niche within VHA. They're separate from, they're together with us but separate. So they do really their own thing. This is a service for counseling service for combat veterans, their families. The eligibility requirements are quite a bit different, and I know we have vet center staff here today, so that's good. If you have questions about this afterwards, they can answer some. I'm going to do a brief overview. But really, you need combat service to qualify, and it's pretty easy. They don't have to go through the whole enrollment process like in our regular VAs. They bring in proof, whether that's a medal for combat service, a combat action badge, a combat infantry badge, DD-214 that shows they were deployed in that way, service campaign ribbon, Pretty much, right? That's all you really need to show eligibility and get going in that. Totally confidential counseling services. They provide a lot of marriage and family therapy as well. So it's a great resource. We have vet centers in South Bend and in Grand Rapids, so that are close within our region. So we've got about 5 minutes left to flow through our specific stuff here for Battle Creek. And I know it took some time on that. I think it's really important to get the big picture view of what VA does. So this is a breakdown of our service areas. So the blue, that's what we cover out of the Battle Creek VA healthcare delivery system. So 22 counties of Southwest Michigan, all the way up to Lake County, all the way down to the Indiana border, over to the Lansing area, before you cut into the red is Ann Arbor, the yellow is Detroit, and then the green is Saginaw. The UP is not on here, they're actually covered out of the Wisconsin areas. So you can see our clinics along the side that fall under Battle Creek. So we have a clinic, outpatient clinic in Muskegon, we have an outpatient clinic in Benton Harbor, we have one in Lansing, and then we have our pretty new, only about 2 years old now, Wyoming Healthcare Center in the South Bend of Grand Rapids up in Wyoming, which is becoming the hub of our specialty services. So we're doing a lot of outpatient specialty procedures out of that clinic now. Our main focus with Battle Creek is we are primarily a neuropsychiatric facility. So mental health is our business out there. We do have primary and secondary medical care, specialty care, prosthetics, blind rehab, optometry, cardiology, women's health, pain management, a lot of other ones as well. So we do extended and long-term care out there. We do a lot of preventative medicine, and we have a lot of related social service type programs, our homeless program and other social work type services to provide support for our veterans in the community. So this is the layout. We have a very large campus-style facility in Battle Creek. Really close, if you're not familiar with where we're at, pretty much across the street from Fort Custer, over there off Dickman Road. We have about 1,615 employees that work for our healthcare system, $310 million budget, annual budget. Some highlights of us, we're a historic facility. We were the 100th VA built, so that's important to note. And we really have a lot of, I talked about telemental health. We've had a lot of partnerships with our community mental health partners across our catchment area to bring telemental health into those areas, bring that up. We are the hub for residential and inpatient mental health services for all of Michigan, Indiana, and Ohio for the VA healthcare system. So that we get referrals from all over the state, also from Indiana and Ohio to our facility. So kind of based off of last year's numbers, some highlights. We did over 538,000 outpatient visits last year. That was up a little over 7%. Admissions, over 1,600 admissions for hospital stay. Inpatient bed days, Gary, you can read that. Our uniques, we're up closer now to around 44,000 veterans in just the Battle Creek healthcare system. So that's our unique veterans that we serve. So you hear a lot about access to care. I mentioned direct scheduling earlier, where veterans can go in and schedule their appointments. We're trying to tear down those barriers, not to have to go through primary care, but for some of our specialty services now they can go in and directly service without a referral from the primary care physician. Audiology and optometry being our two that we highlighted first, and more clinics to follow. Big push nationally on providing same-day services to veterans. So what that means, it's not that you're going to get an appointment necessarily see your provider that same day, but we're going to address a need. So whether it's via telehealth, whether it's via phone consultation, whether it's via nursing visit, maybe it's a provider visit, but that is our goal is, if you call today, you need service today, we're going to give you some sort of service today. It might be that telehealth or phone with an appointment to follow up, but at least it can get the ball rolling on taking care of the needs of that veteran. All right. These are our wait times. Everybody talks about wait times out there. Pretty good. So for established patients, averages less than 2 days for primary care visit, about 3 days for mental health. These are routine visits for call in and need it. and for specialty care, 5.36. And that's pretty darn good for specialty care, because I know my wife trying to get stuff in the private sector, it's a lot longer than that. Something that was nationally launched is this new website here. If you're interested in what wait times are for particular clinics in Battle Creek or anywhere else across the nation, you can go onto this website and drill down to the facility you want to look at and see the specific wait times for that facility. Everybody aware Dr. Shulkin's our new Secretary of VA, new only a few months in. These are his top 5 priorities that we're focusing on as a VA overall. I talked a little bit about non-VA care as well. It's not available within the VA. We have a lot of partnerships. Why this type of thing is so important that we need to partner with our folks in the community. Choice is a big thing. Veterans Choice Program continues to change. That's an hour presentation in itself. And I'm sure some of you have experience with that, but if you have specific choice questions, we'll talk about those during our panel discussion. 2 more slides, and before Mike yanks me off of here, one is our My Healthy Vet. This is our access for veterans. They can get online and see their health records, communicate with their providers, reorder prescriptions. Great tool. I actually use it myself for my care. And then 2 really important numbers. We have our national call center for homeless veterans. So any homeless veteran that you encounter, you can call this hotline, and that will get them directly referred to us. Same with the Veterans Crisis Line. You know, not just if a veteran's in crisis, suicidal ideation, homicidal ideation, you call, they'll link it through the National Center to us, and then our local suicide prevention team will follow up. All right, so any questions that you have, please write them down in your card, and we will address those during our panel. All right, thanks. That's a lot to go over in a short time, so thanks.
Well, if I name you, one thing I wanted to remind you of is that all the presenters today and panel members, information is on the second page. Also, will be recorded. So we're going to hopefully be able to offer you an opportunity to share this recorded program with your colleagues at a later point. So Mike and I are working out the details on that now. With that, do you want a microphone or are you all set?
Can you hear me?
No, use the microphone, please.
Oh, okay. Better? Better? Okay. I'm Amy. I'm from the Battle Creek VA. I am the supervisor over the benefits section, which includes enrollment and eligibility as well as the enrollment coordinator. So we're just going to go over some kind of basic eligibility and enrollment things. So to apply for benefits, we encourage our veterans to submit them electronically via the e-benefit site. The e-benefit site also has access to a full list of resources and services related to benefits, where they can come to like the Battle Creek facility or Wyoming facility, and they can apply in person. So the VA is a benefit for the veterans. It's not health insurance. It complies with the Healthcare Reform Act, and health benefits are different for each veteran. So we'll talk a little bit about registration versus enrollment. We have to register you for you to be seen at our facility. However, we could register you and you could be seen even with enrollment. So registration doesn't necessarily mean that you're a veteran at that point. Enrollment, you can't decline enrollment if you want to be seen. enrollment is done through the health eligibility center, so essentially we can take the applications and then the health eligibility center in Atlanta processes all the information. You can decline to enroll or cancel enrollment with written communication to, we call it HAG. And then HEC is the only people that can override the enrollment status. And then your updates are also completed through HEC. So eligibility definitions, you could be ineligible, which would mean that you don't have a qualifying period of service. In the VA Medical Center, they notify you of that. If you are rejected, then health will notify you of that, and that would be because your income exceeds the national threshold, or that the veteran didn't provide us that financial information. So with basic eligibility, the criteria for benefits, so you, prior to September 7th, 1980, you had to serve 1 day of active service. After that period, it was 24 consecutive months. If you're an officer prior to October 16th of 81, then that was 1 day of honorable active service. And then after that period, 24 months again. Reservists and National Guard can also be eligible, but they had to serve the full-time and call to active duty under the executive order of Title 10. Characteristics of service. So on the DD 214, it will tell us how they were discharged. So we're looking for an honorable, under honorable, or a general discharge for eligibility. If you were discharged under dishonorable, bad conduct, or other than honorable, typically you wouldn't be eligible for our services. We do, however, if somebody is in a mental health crisis, even if their DD 214 has been listed as other than honorable, they will still see them with that specific situation. So combat veterans, so this refers to those that served after January 28th of 2003. They are actually eligible for enhanced enrollment for 5 years from the date of discharge. So some of those enhanced benefits are cost-free healthcare, hospital care, medical services, nursing home, and any illness that are related to their combat. They would be listed in priority group 6, and we'll talk about priority groups here in a second, unless they're eligible for a higher priority group. Again, their enrollment begins 5 years from the date of their discharge, so they're available for services for 5 years after. They have full access to the medical benefits package, and then there's also a combat veteran eligibility fact sheet. We do have some of those for me if you guys would like them. So priority groups, once we do your application, essentially we get a priority group for you. So depending on what priority group you are in, that's going to determine the services, your co-payments, things like that that you're eligible for. So priority group 1, these are those veterans that are 50% or more service connected, or they're unemployable due to the service-connected disability. Priority group 2 are the 30 to 40%ers. Group 3 are your POWs, if they have a Medal of Honor, Purple Heart, if they were discharged due to a disability. 10 to 20% service connected, or individuals disabled by treatment or vocational rehab. So total we have 8 priority groups. So priority group 4 are those who are receiving aid and attendance or household benefits, and where they could be determined to be catastrophically disabled. priority group 5 are your non-service connected, or your non-compensable service connected veterans, with income or net worth below, the means tax thresholds. That means taxes your income. Priority group 6 is your combat veterans, those exposed to the ionizing radiation or Agent Orange, and then your Persian Gulf veterans. So, 7 are the veterans with income or net worth above the VA national income or below the geographic threshold, and then 8 are veterans who agree to pay specified co-pays. And then our priority group 8 is going to be divided down into some subcategories, which I'm not going to go into detail about, but certainly if you're a veteran that comes to you, but if you're priority group 8, you can certainly contact us further questions about that. So the medical benefits package, that's going to include your preventative care services, inpatient and outpatient diagnostics and treatment, as well as your prescriptions. So depending on where you're falling into your priority groups, you could also be eligible for classes, hearing aids, ambulance services, non-VA care, prosthetics, or durable medical equipment, dental counseling services, or the foreign medical program. Some exclusions to that medical package are your cosmetic surgeries unless it is unless it's a medical necessity. Health club or spa membership, drugs and devices that are not approved by the FDA. And then inpatient hospital or outpatient care for veterans who are also in another government agency. So co-payments. Co-payments are fixed amounts that we collect from the veterans for care of goods and services, like your medications, your outpatient visits. A lot of our veterans do qualify for the cost-free health care, and then you can kind of see those are our purple hearts, our POWs, your 50% more service connected, and some of those others that you can read there. We do want you to complete a financial assessment on a yearly basis. Because if your finance change, then you might qualify for more services or a less copay. So this kind of goes into the copays. So for primary care services, the typical copay amount is $15, and specialty services is $50. There's no copay requirement for preventative services. Like your screenings or your immunizations, and then you're only subject to the highest applicable copay. So if you have a primary care appointment and a specialty appointment at the same day, you're only going to be charged for that specialty copay. You won't be charged for both of them. Pharmacy, they have your formulary and your non-formulary medications. Your formulary are going to be medications that we have in stock at our pharmacy. If they ordered, if you need something that's non-formulary, they can certainly order that as a special order. This slide shows the medication copay. So again, that's reversed back to those priority groups. So if you're in priority group 1, you're not going to have copays. And then if you're priority group 2 through 8, you can kind of see that chart there where it breaks down. So depending upon the medication, depending on how many days supply you're getting, these are the copays that you can be charged. There is a $700 co-payment cap, so you won't be charged more than that in a year. And then there is a website there for co-pay and medication information as well. So one of our specialty services is dental, and so to be eligible for dental, they have to be 100% service connected, or determined unemployable by the VA. Service connected for a dental condition, so these are all different ways that they receive dental benefits. POW, within 180 days of discharge is indicated in the TD 214 if they're homeless or enrolled in vocational rehab. I know Matt touched a little bit earlier about services that the VA covers. So again, this is just kind of another breakdown of some of the services that we do offer. So when a veteran comes in, we issue them a fit card that is actually done out of our urgent care area. And the card isn't in insurance. They give them an assignment. They come in to check in for appointments. Travel. So travel pay is my favorite. So dependent upon their service connection, if you're getting a pension, you can kind of see the breakdown there. If you're going to receive travel for your service connected condition, or if you're eligible for it for any of your care. If they're not eligible for travel, we do have a details clerk in Battle Creek. His name is Lance McCreary, and the veterans can certainly reach out to us, thinking if they can get rides from family or friends. We have the veteran transportation system, the DAV can help with that. So there's a ton of resources out there that we're certainly willing and able to help families through and to get them to their appointments. And then last but not least, again, I'm the enrollment coordinator in Battle Creek. And so my phone number and extension, we have an enrollment office in Battle Creek as well. And the 33887 is their extension, and we also have enrollment in Wyoming. And their number and extension is listed as well. So as Matt said, if you have questions, please write them down in your note cards, and then we can address it during the panel. Thank you.
All right, she got that done a little quicker than. So we're going to take a break for about 10 minutes, give you an opportunity to use the restroom, grab lunch, grab a soft drink, and then we'll get the panel assembled. If you have questions on cards right now, we'll take them off your hands. If you don't, this part, the panel part, you don't have to have a question on a card. If you have a question, that part of the question, by all means, raise your hand during the panel. All right, thanks. Take a break. See you in about 10 minutes. 12:05.
Thank you.
What's that do? All right, we're ready to get that going again. If I get your attention. All right, so show of hands. Who is more confused now than they were when they got here? Yeah, it's a lot of stuff, a lot of information. Some of you need, some of you don't need. But it's like Matt said, it's a very dynamic organization. They take care of a lot of people. And so this will be your opportunity now to ask that specific question. If something popped up on the screen and you just kind of flew through it, please, by all means, ask the question. I'm going to turn it over to Ann Zemlick. Ann is a part of our healthcare subcommittee, a large part of our healthcare subcommittee. What's that? So if she is going to moderate the panel, she's got the questions and she's got control from here.
Ooh, that's scary, isn't it? So, welcome, we're gonna start a panel. I'd like to start having those that you don't know yet introduce themselves, talk about where you're from, what you do. You have 1 minute.
All right, so my name is Aaron Eccleston. I'm the director of Calhoun County Veterans Affairs. And the purpose of our office, what we spend the majority of our time doing is filing disability and pension claims for veterans. Another large part of our organization is helping with emergent needs. So if a veteran needs help with rent or car payment or utilities like consumers or Simcoe in Calhoun County, we help with payments for that too. And then we also, on the healthcare side of things, we do kind of like middleman work between the veterans and the VA. A lot of times veterans will come into us to mention things that they need help with the VA with that they don't mention at the medical center. And so we've garnered relationships with the medical center so we can non-adversarially approach those and kind of do a hugs and handshakes approach to that.
I'm Alicia Bogema. I'm the non-institutional care coordinator at the Battle Creek VA. I'm a social worker by trade, and I'm here to talk about our home and community-based programs. So adult day health care, contract nursing home, home health aid, in-home skill, in-home respite, and patient respite. Those are some of the services that our section covers. So I can answer questions on those.
My name is Amy Pennington. I'm the Assistant Chief of Health Administration Service at the Battle Creek VA. I pretty much focus on the non-VA care part of it, the choice part of it right now, because it is such a big program. But we do have 109 people in our service, and we cover almost the whole state, or the whole west side of the state. So anything administrative.
I'm Matt Newman. I introduced myself when I was up there, so I'm going to listen to it again.
What do you do?
What do I do?
What do you do with the message?
I don't know. Well, as the acting associate director, I'm responsible for pretty much most of the non-clinical areas. So health administration service falls under my purview. Police, fire, nutrition and food, fiscal, and a laundry list of others, prosthetics. And then as the health system specialist to the director, when I go back to that role, I oversee the customer service program for our healthcare delivery system. I also have a piece of public affairs, strategic planning for our healthcare delivery system, and all safety programs. So.
I'm Amy Aiken. Again, I introduced myself earlier, but I'm the supervisor over the benefits section that falls under the Health Administration Service, as well as the enrollment coordinator for the Battle Creek area.
Wonderful. And I apologize, does this come too much? Yes. So I apologize for the hum. How's the volume now? Okay, all right. So one of the questions that we have here, and I think we need some clarification, and ask, why do combat vets have a 5-year wait for services post-discharge? And I need some clarification, because I know there's a 5-year wait versus they have 5 years too.
That's correct. They have 5 years of their eligibility from their discharges. They don't have to wait 5 years because they have that automatic 5 years. So you want to add anything to that?
That makes them eligible for that special enrollment.
Right,
so
for the special
The
enrollment.
minute they're discharged, they're eligible.
And that doesn't necessarily mean their eligibility goes away after 5 years. It may for some, but unless they may fall into a different group after that, but it's not a different priority group. One thing I think it's important to note, those priority groups that Amy went through are very confusing, and try not to get too specific on eligibility when we're in a large forum like this, because each veteran is unique in their eligibility. And so working with Amy and her staff is a good way to determine what a veteran's eligible for. On a national level, our secretary is really urging the legislature to enact some bills and some legislation to consolidate those eligibility buckets. Part of the reason that it's like that is because every piece of eligibility, since we are the federal institution, is tied to a piece of legislation. So anytime they make a new veteran eligible for services, it's tied to a piece of legislation. So there's a lot of different legislation out there that different eligibility has been tied to over the years, and it makes for a pretty confusing different buckets of eligibility out there. So that's something that our secretary is working on at a national level, urging Congress and to enact something that's a little more simple and user friendly.
Thank you. Thank you. So another question is, how do you go about obtaining medals for veterans who've never received any?
I'll take that one.
Awesome.
So if you have a veteran that comes in, or a family member, surviving spouse, or dependent, and they're looking for medals that a veteran never received, of course, I'm biased. I'm going to say go to your county veteran service office. I know Mike Austin Kalamazoo is over there, so the majority of you in this room are probably going to turn to the Kalamazoo office, but they're going to be able to order those medals for that veteran or that family member.
Thank you.
Hey, Aaron, did you share that there's veteran service officers in all the counties?
Oh, yeah, and then every county has a veteran service office. It's not just like Kalamazoo. I should say the majority of them have.
All of ours are.
Yeah, in Southwest Michigan, you'll be taken care of.
And how do they contact their veteran service office so they don't know where it is in their county?
Google. Mike, the MBAA.
1-800-VCAT.
Yeah, so I was kidding here. So the MBAA has a great website. It's pretty much a drop down.
What's MBAA?
Michigan Veterans Affairs Agency.
The website's michiganveterans.com.
Yep, great drop down, and you can just pick what county you're in, and it'll point you in the right direction. Or you can call the phone number, Mike.
1-800-VCAT. Yeah. 642-4838.
I can't write that. So that might be something we can make available to you as well.
It's on those cards on the table behind.
Perfect. Perfect. Awesome. Thank you. So in regards to combat status, what about a person who serves in a non-combat time? However, during their time in the service, they experience some combat-related type issues. Can they still get services and assistance through the VA?
You don't have to be a combat veteran to get services in the VA. But you fill out the application and you can be a veteran without being serving in combat. You just have to fill out the application. We enroll you and see where you end up. And if you have issues that are combat related that happen while you're in the military, you may want to file a claim to get service connected for those conditions.
So there are service-connected issues that veterans have from non-combat periods too. If you're injured on active duty, there's even service-connected veterans who were injured in basic training and never really, didn't go through a whole period of service. So that's a big piece. So it can be that you have a injury and then you're discharged as connected, or you have to go through the compensation and pension process, which we kind of talked a little bit about. VBA will handle that, but you don't have to be combat veteran to have a service-connected injury as well, and that goes for military sexual trauma as well. There are quite a few veterans out there that are non-combat veterans but are service people that have military sexual trauma issues. So that's a big piece to remember as well.
And where should a person start to be able to access that then? Is it with the VSO? Is it with the
Yeah, if you're looking to file a service-connected claim, your best place to start is with one of our VSOs. They are experts. They do that day in, day out. They know that stuff. Yeah. What's that? CVSO, right. Thanks, Mike. Yes.
Yeah.
So, yeah. So start with them and
acronym, right?
Yes. Yeah. So with your counties, those offices are set up for that. Also important to distinguish is that I mentioned it earlier in my presentation that 5.5 million peacetime veterans out there. A good way to ascertain if somebody's a veteran is not to ask them if they're a veteran, it's to ask if they've ever served in the military versus ask if they're a veteran. You will get a lot more yeses from that than because people won't acknowledge as a veteran sometimes, especially the peacetime era, today's type veterans, and will not consider themselves veterans.
Thank you. Thank you. So we talked a little bit about income thresholds in regards to getting services and co-pays. So can you talk a little bit more about that in regards to, is it household? Is it you take into consideration assets? what are a little bit more in depth of that?
Okay, so when you fill out an application, it's gonna ask for the gross annual income, and that is for your household. So if you are married, your spouse's information also goes in the application. We no longer ask about assets. We will ask if you yourself as the veteran have any like college college debt that you have incurred in the last calendar year, as well as like funeral and burial expenses. But as far as assets, we don't ask about that any longer.
So, along those lines, what about some of the holistic approaches to care, such as acupressure or acupuncture? Does the VA cover the cost of those types of service? And if you do you have someone who actively provides that type of service at the VA Medical Center, Battle Creek, or any of the outposts?
Right now, we do have acupuncture and chiropractic at the Wyoming Healthcare Center. So, and as we're looking at pain management and different ways to treat veterans to manage their pain, we are looking at more ways of doing that. And if they're out 30 days, which they are, because we have one chiropractic and one acupuncture for all of our veterans, then we can place you out in the community for that, and you can be eligible for the community care programs if our access is out 30 days. So, your primary care doctor just needs to put a referral, and then we work it from there to get sent.
Amy, would you talk about that a little bit more, please, about being out 30 days, what you're referring to?
So right now, Dr. Sulkin is looking at access. We've been looking at access steadily for 3 years, and we meet weekly to look at where our access is at. And if we are 30-day late from your desired date, then we were eligible to go out in the community for this care. And right now, the community care program is changing daily. But whatever program we have to get you through to get the care, that's what we're going to get you into to get. So any time it's over 30 days from your desired date, then you're eligible.
Could you talk a little bit? I know personally we've got a lot of care managers or care consultants in the room who serve veterans. And so, one of the questions I always hear is, how do they access that? How do they initiate working with the choice program to get care outside of the VA Medical Center?
Okay, so that's, like I said, changing daily. In order to start a process, you have to see your primary care doctor and be referred to those programs, unless it's something like audiology or optometry, which we're direct scheduling. You don't need a referral for that. But you start with your primary care doctor, they do a consult, that consult is received from the service, and that service is not available within 30 days. That's how you access the non-VA care program. Right now, the choice is only taking the 30-day waits and the 40 milers. And 40 milers, I'm saying you live 40 miles from any VA facility. So if you're 40 miles from the Benton Harbor Clinic, you're not eligible, even though we may send you to Ann Arbor for the care, it's to the closest facility. So it can be very confusing, but we have very good staff in our non-VA care that's going to call you once you're eligible for those programs and direct you in the right way to get care done.
So when in doubt, call your case coordinator, and you have to start with your primary care physician at the VA Medical Center. We have a comment or another question on that?
That's what I was going to ask. When you said PCP, was it at the VA?
The VA primary care.
Yes.
Okay, thank you.
How does the VA Medical Center primary care work with community physicians or specialists or other health providers in, day-to-day, whether it's prescribing or treatments?
Every primary care team has a care manager RN who can facilitate that for the veterans, or you can go through if it's additional services you need from, like if we refer you out to the non-VA care, then we work with the non-VA care team who will work with the doctor to get those services.
Thank you. So if a person is drawing a death pension for a spouse who passed away, if they draw Social Security benefits, would they lose their pension? So I'm taking it as a surviving spouse who's receiving that pension. Does it impact their social security pension?
So that's really, it's a VBA, it's a benefit side question, so I'll take that one. Pension is based on income. So there's two death benefits on the benefit side. There's DIC, which is for a veteran, surviving spouse, veteran passed away from service-connected disability. And then there's the pension side. The pension side is income-based, the DIC side is not income-based. So dependents and annuity compensation. So, to answer the question, yeah, Social Security does impact pension for the VA.
Will they lose all of it? She's worried about applying for Social Security because she doesn't want to lose her $721 she gets monthly delivered.
Well, the way it works, the VA, there's a cap on benefits, Social Security and VA, and she's going to get the cap. So let's say, I'm not a math guy, so let's work in round numbers. She's getting $1,000 from Social Security. The VA benefit is $1,200 a month cap. So what would happen is she would get $200 a month from the VA and her $1,000 from Social Security.
So
Right.
she only gets $721 and $1,000 from Social
Right.
Security, she'll lose all of her.
Right. You're going to get money from the government either way.
Okay.
It's just who it comes from.
I just want to be able to explain.
Yeah, when in doubt, why? In that case.
Right.
Well, it sounds like, and that, even if you don't understand the application, or you're just working through the VSO.
Go see your money.
Yeah, might be helpful. Who do you contact? Who do you contact to start the referral process for a non-VA care? You talked about primary care. You talked about the care managers or the nurses and the social workers on the primary care team. Is there another way or another avenue to access?
The only way right now is the 40 milers, and we have a few, like in the Ludington area, the Coldwater area, you can access choice directly. You can ask for a primary care doctor, you can, when you choose choice, you're leaving the VA system. So it's a third-party administrator, and they're struggling right now with getting patients scheduled. So it is a big deal that you're taking your hands out of the VA and going into another third-party administrator to get your care.
Just to add on choice, so we're coming into a transition period on choice. So that the choice program, as it's referred to, that's legislation that was passed almost 3 years ago, was set to expire in August of this year. So the original bill that was passed was for 3 years, or to use up the $10 billion that was allocated to the program. Just back in April, the president signed legislation to extend the current choice program. There's a company called HealthNet that is the contractor that administers that contract in our area. It's Tri-West out towards the West Coast. But so it's extending that bill till the exhaustion of that money. All right. And right now, the secretary has been working very closely with staff across the United States to come up with what they're calling, for lack of better terms right now, Choice 2.0. So I'm sure there will be some sort of legislation that is passed probably in the late fall, around maybe to December, hopefully to extend that program. What that looks like right now, we're not exactly sure. We do know there's going to be a lot of changes. The secretary wants to change that 30-day, 40-mile rule for eligibility because that seems to be kind of arbitrary on that. So we'll probably see a greater choice for veterans with fewer restrictions on that. But they've got to work out what that price tag is associated with that for that care. So there's a lot of transition, and like Amy had alluded to, is that we are literally changing from, if not day to day, at least week to week on what's going on, what's changing, because this is a major transition period for us, and we're receiving guidance almost daily on what we can and can't do, how we're going to use that existing money that's left versus going with our traditional non-VA care programs that were in existence before choice was enacted. So that's a really confusing topic right now. I know we're happy if you have specific instances on that. This team, we can work with you on that. It's probably better for us to do it more in a one-on-one session because there are a lot of nuances to individual situations. But we're happy to help And as Amy had said, when you choose to go to choice, you go outside the VA. We actually stood up a choice navigation team of our own VA staff to help veterans navigate the choice system because of the confusion and difficulties that came along with that. So we have a lot of dedicated staff that have been working very hard to make sure veterans get their care if they choose to go that route. So hopefully that clarifies a little on choice.
Ian, I got a follow-up question on that. Isn't it true that doctors have been told at Battle Creek not to send any more patients to the choice program right now?
Right now, the only things we're authorized to send to choice is the ones that are 30 days out or the 40 milers. Anything that we were sending out, a lot of the choice first, like for the care that we don't provide, mammograms, PET scans, that kind of stuff, we've had to stop that. We're sending that out either provider agreement, because we still do have a little bit of provider agreement money, which some of you may know about the provider agreements. We've been reaching out to our partners in the community, trying to work with them to sign up for the program, or our traditional non-VA care. We're still getting the patients the care. We just have to know what bucket of money we have to authorize the care from right now.
It's important to note, you know, since it is federal programs, Congress allocated money to the choice program, and through a separate allocation, it's to our traditional non-VA care program, our medical care in the community dollars. So there's two separate buckets of money that go along with two separate programs. They're not interchangeable the way that they're allocated to us to use. So that is another thing that the Secretary is posing to Congress right now, is that to make one consolidated bucket of care in the community money, so we don't have to go back and forth at the local level to try and figure out where we can fund the different care from in the community. So just to clarify, we're not sending folks out for the care that they need. We're still sending them for the care. It just may be through a different program than choice because of where we're directed now on how we have to use the funds.
I like that you're being inventive to get them the care.
Oh, we do.
Because we all know about Jonathan rules and funding stipulations and guidelines. We have another question over here.
Yes, sir.
Does that care include mental health care, or is that just?
Yeah.
And if so,
Go ahead.
The mental health care is available in the community if we're out past 30 days. If we can provide the care within the VA in a timely manner, you have to go to the VA to get it.
So, say they choose a mental health person, I would think that person has to be approved through some sort of a system to get reimbursed.
If we're using provider agreement money, yes, it does. We have to have the provider sign a provider agreement, and it's really just basically letting you know what you're going to be paid for your services and what you're agreeing to. If we use our traditional non-VA care, we let the patient choose where they want to go, and we authorize the care, and it lets you know what you're authorized to be seen for when you get the authorization.
And that authorization will include duration.
It'll include visits, and what they're, you know, if you need additional services, like I said, we call the non-VA care office and we'll work through the primary care doctor.
What about emergency care? So somebody's in Kalamazoo, they can't make it to the VA medical center, and I think
we have an emergency care program. 1703 is what it's called. And the most important thing to do is to have your patient call the VA within 72 hours to notify us that you had to be admitted emergency. And then we have a team that enters those authorizations. We have a clinical team that reviews them to make sure that this truly was an emergency. Not all veterans are eligible for it. It is kind of confusing, but the most important thing to do is have the veteran notify the VA within 72 hours.
Who do they call?
Yeah, who do they call?
They can, many different avenues. Basically, as long as it gets into their record, they can notify their primary care team. They can call the triage line. They can. There's many different areas they can do as long as it's annotated. Then that they've done it within 72 hours. And that's really, when they review it, they look at the layman's term for emergency care. You know, life, limb, eyesight, that type of thing. If it's an urgent care type thing that, you know, if they're going for a bad cold or something like that, chances are they're not going to get covered for it. We do, and it's important to know, I don't know, I didn't mention this earlier, but we do not have an emergency room through the Battle Creek VA healthcare system. We have an urgent care in Battle Creek, the 24/7, 365 urgent care, but we do not have an emergency room. So if you are working with your patients and they have an emergency, please, 911, go to the local emergency room. Don't try to come to the VA because that just delays care if it's a true emergency that they need to be seen in the emergency room. Because then we just have to turn around and send them out locally to a local ER. So, okay.
One of the things that precipitated this event today was questions from hospitals when it comes to billing and that process. So I hear what you're saying in regards to the veteran and the families, you know, call within 72 hours, kind of like regular insurance. You know, you want to call, make sure whatever is you're eligible for payment. So who would a hospital biller call if they're getting kickback or need to negotiate something?
We, all of our claims are paid by our central business office at this time. So you would just need to contact them. I am, like, Thursday we have a big meeting with the Bronson hospitals. We are trying to set up, if you have any needs for billing questions or want some contact information, please let me know. I'll give you my business card. We really are trying to build our partnerships with our community providers because with Dr. Sullivan's new healthcare, they're going to have a choice. So we want to be able to get our veterans the care where they want to get their care and to work together. So we're trying to be really transparent and we can meet with you guys, we can have conference calls, whatever we need to do to make sure you know what you're going to get paid for that care and you're getting paid for it. So.
I think to echo what Amy says too, you have all of our contact information on that sheet that you got when you came in. We really want to emphasize that we embrace a no wrong door approach. So even if you have any questions about anything at all, even after today, you give Amy, Alicia, myself, or Amy a call, and even if you call Aaron and I talk on a very regular basis, he'll get you over to me. We're going to get you to the right person. We don't want you to have to run around it, and we'll figure that out. So we're really trying to embrace that. It's a no wrong door approach into the VA for veterans for referral for care and for our community providers. If you have issues, we want to help you take care of them. We want to work together.
So one of the questions here is someone who's caring for a veteran and they're concerned about the travel distance. And Amy, you had mentioned about the 40 miles. It's greater than 40 miles. However, this is a person that it's not only a distance, but it's also a great physical hardship for them to make it to one of the VA clinics. Is there any consideration taken for that situation?
With the choice program, of course, this could change, but we have a UEXB program, which is an excessive burden. Okay, so
Unusual and excessive.
right. So if you physically can't do it, your doctor can do a referral. Geo burden is you're kind of treated like a 40-mile. You can go to choice for anything in the community if you qualify for the geo burden. We have a team that meets on those. We review them. We see, okay, does this guy really have hardships, and is it, for like physical therapy, that's an excessive burden. Even to drive to Battle Creek 3 days a week to get physical therapy. So we are looking at things to make it easier for the veteran to get their care in the community and versus having to drive to the VA. But it is restricted on the clinical need or the excessive burden, like some people in the nation have to go over a mountain or something. You know what I mean? So there is different qualifications, but the primary care doctor just needs to refer them.
And I can't confirm yet, but from everything that I've heard, I have a feeling the new legislation for choice that will come out will address that even more to make that burden less on the veterans. That's why that revamped that 30-day, 40-mile rule. I think you'll see something a little more abrasive to those type of folks. So.
I just wanted to mention too for people who are technically homebound or who have a physical disability that makes them not able to get to these appointments, that sometimes skilled nursing is an option as well. And we authorize in-home PT, in-home OT, those kinds of things through our home and community-based program too. So it's a short period of time. I think typically they'll do up to 3 visits a week, so it's not as extensive as sometimes, your everyday that you can go to physical therapy or occupational therapy. But if you need in-home skilled nursing, PT, OT, that kind of thing, we can do those for home and based as well.
And there's a follow-up question in the back.
Yeah.
This is kind of along the same lines as that. I'm down in Cold Waters from one of the 40 milers. I have a couple of veterans who are bedridden. One of them is currently getting in-home health care, but now he's ready for hospice. When trying to contact the VA and getting him evaluated and set up for hospice, he was told that he needs to be seen at the VA, and there's no way to do that. So what's my avenue then? How do I get him seen to get evaluated and get into hospice?
I think I actually heard about that situation. My supervisor's been on me, and I'm sitting in here for her today, and I may take your number for follow-up, but what I understand is they were trying to coordinate with home-based primary care so that one of our providers that does go out to the community and sees patients in their home could come out and certify them for hospice. So they were trying to look at different ways that could happen. That unfortunately hasn't come up yet. It was the first, yeah. So but yeah, and they're trying, and I just heard about it in the last couple of weeks. So they are working on it, but if you want to meet with me, she'll be back tomorrow and we can kind of see where that's at. But I do believe home-based primary care was going to try to come out.
Could you talk a little bit about the home-based primary care and what the eligibility is?
So for our veterans, there's lots of different in-home care that can be received. Home health aid is a standard that a lot of veterans receive. You have to have 2 deficits in your ADL needs, so you need assistance with bathing, dressing, grooming, that kind of avenue. A lot of veterans have the perception that if they need like cleaning, housework, that kind of thing, that qualifies them, but it has to be an ADL need. And then some of the home health agencies are willing to help with like housework and things of that nature, but you have to have an ADL need. So if the veteran's not willing to accept any assistance for bathing or grooming or any of those ADL needs, then they won't qualify for the HHA services. We have in-home respite and inpatient respite. And so you can have, veterans can have 30 days of those combined within, it's a little tricky because one's a calendar year and one is an authorization year. So our social workers, our primary care outpatient social workers will add that up and see where they're at. But 1 6-hour shift in a home counts as 1 day, as 24 hours in an inpatient unit counts as 1 day. So they can have 30 of those combined in their calendar and authorization year. In-home skilled, which I just kind of touched on, wound care, medication management, IV. A lot of times our in-home skilled will try to find someone who is teachable, either the veteran themselves or a family member, and they will come in a couple of days right off the bat, show them how to do the IV, show them how to do the wound care, and then follow them for a couple of weeks and check back in if needed and be available like any in-home skilled agency would be. But we don't do where Medicare, I believe, does, they can come out every day for weeks. We try to teach the veteran or their family member on how to do that care. We have adult day health care services, which I'm the coordinator for the adult day health care and the contract nursing home programs. So adult day health care is a super underutilized service that we have. We can authorize veterans up to 5 days a week, 6 hours a day for adult day health care services. Typically they start at 3 days and that's what's clinically indicated. But if it's a situation where a veteran is going to be hospitalized, placed in an assisted living, placed in a nursing home, but if they get 5 days of adult day health care, they could stay in their home. We are absolutely able to authorize that care. Most of our adult day health care agencies provide bathing within our contract, and they provide transportation within a certain area. So that is a very good service. We have 9 that we contract with in Lansing, Wyoming, Holland, Battle Creek, and Kalamazoo. And so that's a program that you would as well go through your primary care provider and get a referral, and then the veteran would visit the agency, and then we would authorize for the days that they needed. I think those are, and then there is a home-based primary care program, which is a separate entity from home and community-based programs, but that's a program that you can utilize if you're technically homebound, which is a loose term. It can be evaluated with your outpatient social worker and your provider to see if the veteran fits in that era or that area. And they provide nursing, mid-level provider, dietary, some areas physical therapy, psychology, and typically the nurse goes in 1 to 2 times a month. So if it's something that someone needs to be seen more than once or twice a month, then it needs to be in-home skilled nursing. But home-based primary care can do that. And the veteran has to be evaluated by every the dietitian, the social worker, the mid-level provider, and the nurse. However, they don't have to have services from them. So if after their initial evaluation they don't want to see a social worker, they don't want to see a psychologist, they don't have to. They can use it for nursing and for dietary needs. So, and all of those programs are consulted through their primary care physician. And if I could just talk about contract nursing home real quick too, because we have 7 Betty Lodges that we contract with now for our contract nursing home, and those are for veterans who are 70% service connected and higher. There are caveats to that. Hospice, if you are service connected for a condition that makes it so you need nursing home level of care. It can be for long-term care, it can be for short stay rehab. And the benefit to this is awesome because I worked in the community living center for 5.5 years on the Battle Creek campus before taking this position. And when we didn't have the contracts, all of our veterans would have to come to Battle Creek, or they would have to go to a contract that we have with Ann Arbor VA, Saginaw VA, Detroit VA. So now we have our own contracts in Wyoming, Holland, Battle Creek, Marshall, Lansing, and Portage. And if a veteran lives in that area and they prefer to stay by their home and go to a contract nursing home in that area, they can absolutely do that. There is certain eligibility for it. And I've done some educational meet and greets with Bronson, Battle Creek, Gorgeous, and Oaklawn to try to get some information about that. But if you guys ever have any discharge planning needs from the hospital, call me and I can try to help set up whatever need be. A lot of times, like Matt was saying, the veterans don't know if they may think that they're 100% service connected because they may be paid that way because they're unemployable, but we have to look in their chart and verify that they have those services. And so if you guys ever have any questions about that, you can always contact me.
Thank you for that. That was really good information, by the way.
Thank you.
When you were referring to the adult day programs,
Yes.
Does that criteria the same as the home-based, where you need to?
Nope.
What's the criteria?
Did everybody hear that? So she's asking about adult day programming. If the eligibility criteria is the same as for veterans to access the home-based services?
So adult health care is a lot looser in their criteria. You really just need to have one of 2 needs. Either a caregiver, there's a caregiver who's feeling some burden and needs some respite, or their veteran needs some socialization. So they don't get out of their house much. We see a lot of our dementia population with the adult day health care, but it doesn't have to be. If there's veterans that live alone and they just need socialization, or they have a caregiver come in a couple of times a week that needs some respite, that's what adult day health care is for.
Who do they contact?
They would go through their primary care provider as well. And so there, a lot of times every primary care provider has a outpatient social worker, and they have, each doctor has one assigned to them. In Battle Creek there's 2, Grand Isle, Wyoming there's 4. So there's one at each CBOC now. We're fully staffed with social work. So a community-based outpatient clinic. So there's social workers there. So they can contact the social worker and they can help them. But ultimately, if they haven't seen their provider within the last year, then they will probably need to come in because they have to have a chest x-ray or a negative TB test. They have to have an updated med list, a history and physical. But say they just came in and saw their doctor a month ago and they didn't realize they could get this service and they wanted it, they can call their social worker and they can put that referral and they don't have to come back in.
And just to clarify, the only contract you have for Kalamazoo is WMU, correct?
Yes, right now. Mary Virgin, Battle Creek, and WMU in Kalamazoo.
So just to access all of these programs, they have to go through your PCP to be referred to them?
Pretty much, yes. I mean, there are different caveats, like in the contract nursing home, if I case manage those veterans and if they need specialty services or they're discharging and they need other services, we may be able to do like a one-on-one call with their case manager that every provider has because they're being seen in a medical facility. But if they're at home, then more than not. A lot of providers will make that decision too, based on the last time that they came in, and they might want to see them again. So it just kind of depends. It's case by case. But if they start with their social worker, they can meet with their provider right away and let them know if it's something they need to schedule for.
So, I'm sorry. So is there a way that, as working with veterans, that we can call somebody at the VA and find out who their social worker is?
Yeah, absolutely. You can call me.
Okay.
Yeah, you have my number. And that's something I've said it when I've done these educational meet and greets at the hospitals is we all know that the VA is a huge entity and it can, I mean, I can get transferred if I don't know the extension that I'm looking for. So call me. I know anything social work related, anything home community based related, even if it's not, I can ask questions and find out who it is. So if I'm traveling, because I visit the veterans that are adult health cares and our contract nursing homes, so I do travel, but I leave an extension on my voicemail of who they can call. But yeah, just call me and I can get you.
Correct me if I'm wrong, but we've also called just the VA general number and said, I'm looking for the social worker in charge of this team, or you can share the patient's name and identify information for them to give you that contact.
Yeah, if they know their team, then the operator should be able to transfer you to the right person.
So we have another follow-up question, but I want to ask, you mentioned that there are 9 adult day programs and 7 Medalodge nursing homes that you contract with in 22 counties?
Yes.
So, any more in the works?
So the contract nursing home is actually fairly new. We had contracts for a period of time for the last 4 or 5 years. I don't think we had any contracts. And so it's actually been a work in progress. We had a new social work chief and he had contracts where he was and he really pushed it through. So I think eventually if we can show that they're being utilized, right now we're averaging about 15, anywhere from 10 to 20 veterans a month in these contract nursing homes. So if we can show that they're progressively growing and that there's needs in other areas, we try to space them out so that they would, touch on some of those areas that are underserved. But I know there are some places still that those are a far drive away. So we've discussed that. Adult day healthcare right now, we're not looking for any more, but that doesn't mean that we won't, again, in different areas. I have a list of agencies that are interested in contracting with us that I keep so that when we do open those doors, we can let them know.
And I just have to put a plug in here because those of us at the Area Agency on Aging also contract with the Medical Center through the Veteran Directed Home and Community-Based Services. That'd be a great way to get them in when there aren't any other ones. Hold that thought, please. We have a question over here behind you.
Right, for the adult day healthcare thing, now her and St. Joe, is there any way for our veterans, they have a lot of transportation issues?
Right.
They use transportation to get to and from that program?
So transportation in that area is something we've been looking at. Are they going to like the Harbor House? Do you know if that's the one that they utilize for adult day healthcare services?
Well, they don't have, I'm just trying to think for our patients.
Okay.
Or if they don't, they want to utilize one of them.
Yeah, so there is one in that area, Harbor House, but it's in, St. Joe we've had travel issues, and we've been working with our adult day healthcare services because they have, their own transportation as well that potentially could work out with the veteran. It's not in our contract, and so we aren't authorizing it, but it is something that they could privately pay for too.
So I think the home-based services is something that maybe we have to bring back again. It's a big animal, and the VA is a big animal, but there's a couple other questions here that don't have anything to do with anything we've spoken about, and I'd like to get to those before we have to end. So one is My Choice Waiver, which is a Medicaid service. There's been some information that if a veteran is receiving aid and attendance benefit, they would not be eligible for the waiver services, as it looks like it might be a duplication of services. Is there any truth to this? Is there somebody they should contact to explore that?
That's not the VBA.
Your county veteran service office.
I think it has to do with the Medicaid eligibility. Is that who, does anybody mind Ruth wants to expound on this question a little bit more. Yes.
I used to work in a post-acute skilled nursing facility, and we frequently did run into families that were getting aid and attendance in the home. And in the application process for Medicaid, DHS had explained to us that aid and attendance did count as income. So I knew that one family spent a couple of months working with their local senior veterans and services county office to get disenrolled from that so that then the Medicaid eligibility would go through. That's the one time I experienced.
We have a waiver specialist here.
Is there a portion of that is included?
Yeah, if they're, a lot of times when they get aid attendance, they get a non-service connection pension as well. And
Aid attendance?
should be the only income that's counted because the service connection pension or the non-service connection pension, from what I understand.
I think it's opposite. Pension is counted, the aid attendance is not. Aid attendance is not counted.
Aid attendance isn't much.
So one is counted and one isn't.
The pension is counted, as it is on the aid attendance part of that, it's not.
Here's the way I explain this whole aid and attendance. When you say aid attendance and pension, you're talking about the same thing. Aid and attendance and pension is all. Pension is like an added portion to the or aid and attendance is an added portion to the pension. Same thing. So the way I describe it to families is aid and attendance or a pension is kind of like a parachute getting down to the waiver. It just kind of breaks your fall because eventually, even with a pension, the cost of care exceeds what you get from aid and attendance, almost 100% of the time. And so eventually you do go on waiver and that you can get a portion of that pension still, but it's a very small portion and it's meant for like.
Isn't it directly related to the income and Medicaid eligibility? It's more that aspect than waiver or aid and attendance or pension. It's they have to be eligible for Medicaid, and if the assets or the income is counted for what their income is, that might precipitate them from being eligible for Medicaid. Make sense?
I would say don't ever count yourself out for waiver, because getting aid attendance is not going to count you out of it. But, I mean, it is, your income has to be below 2,200 or 2,205. So that's with your Social Security, your any pensions you get, your VA pension, your aid attendance portion of that VA pension would be excluded. County towards that, you're not able.
So another big animal that we probably need another presentation on is community services, how they engage with the VA services.
Well, I was just gonna say, that happened to one of my clients. He was on Medicaid waiver and he was kicked off because his aid and attendance put him over income. So I guess it depends on the benefits, what you wanna do and individually how you wanna do it. But now with aid and attendance, he's paying privately for care 24 hours. So he can do that with his aid and attendance, and he's getting that from waiver. So you're gonna benefit either way.
Yeah,
But
ultimately.
it does kick you off if you're over income. That's just what I'm
Like ultimately, the way the VA works is they're gonna do whatever they can to give you the higher benefit.
Right.
If that's to get rid of aid and attendance, they're gonna discontinue that. So that's how that works.
So I have one more question here, and I expect a real quick answer. If a vet has private insurance, however, their adult children don't, can an adult child be served by VA Medical Center?
Simple answer is no.
I think I thought. So, you had another question. We've got one more minute here.
Yeah, we have two veterans on the mission. How do you coordinate nursing care?
So for the veterans homes, our social workers can do referrals. Technically, since we're closer to Grand Rapids Home for Veterans, that's the one that we utilize the most. But we are not any other than that they take veterans, their state run and we're federal run. So we would go through the process of referral just like any other agency in the community.
You always provide that as an option.
Yes, absolutely. And that's something that we try to work at is providing options. One thing Aaron just said, same thing with in-home skill. If the veteran has Medicare and they can get the higher benefits from Medicare for in-home skill, we'll ask the veteran if they want to use their Medicare benefit, and they always give that option. It's the same thing with our contract nursing homes.
veterans don't have to use that if they're 70% service connected or higher, but they should be given that option. So,
And
yes.
just one thing, if a veteran is 70% or more disabled, they can go into a state VA, or excuse me, a state veterans home for free.
So, I'd like just one last tidbit of wisdom from each of you. Go ahead. Actually, no.
So I would just say, the enrollment and eligibility process can be really complicated. So if you're in doubt, just, give us a phone call. Because so much is individualized, for that veteran. So just give us a call and we'll help you through it.
And I just say is, I've said this earlier, but we cannot take care of our veterans alone in VA. Veterans first and foremost are residents and members of our local communities, and we need to treat them as such in a holistic approach and wrap around with every service that's available out there to take care of the veteran. They've given a lot for our country, and we as a community need to come together to take care of them. So if we can be of assistance at the VA in meeting the needs of veterans in the community that you're serving, please contact one of us. Don't be put off by you think it's too hard to get into or too busy, too big. Call one of us. I guarantee that we'll follow up or have somebody else follow up with you, and let's continue to work together.
And I'm feeling about the same lines as Matt. I work, very closely with care in the community, and we're here to be a partner. If there's any questions, we will definitely get some answers and work with you. It's a very complex system that's run by the government, and we know how difficult that can be. And we have like 3 or 4 different programs going on right now, but don't let that scare you. We're the ones internally that determine and get that veteran where he needs to be.
And I just wanted to reiterate that we have a lot of different programs that most veterans and even community providers probably don't know about because there are so many of them, who's eligible and who's not. So please always give us a call. Just because there was a situation with one veteran and that person didn't qualify for services or didn't qualify for the service we're looking for doesn't mean that the next veteran won't. So always feel free to contact us and ask us any questions.
So, if I could impart one piece of advice, finally, it would be to have a plan and action in place. So when you come across a veteran, whether it's the county office or the Michigan Veterans Affairs Agency, or you find one really good contact at the VA, like, Matt said it, I email Matt once in a while, I'm like, hey, I have no idea what I'm doing here, what can you do? And Matt usually knows. In fact, he's never failed me, he's always put me somewhere. So have that plan of action, and whether you divide it up, for healthcare, I'm gonna call Matt, for benefits, I'm gonna call Mike. Just to have that plan in effect, so when a veteran comes in, they see that confidence, and they feel right away that they're gonna be taken care of. Because the veteran's gonna pick up on whether you know what you're doing or not, and even if you don't, find somebody that does. This is how that veteran helps.
Wonderful. So I want to thank the A team. I don't know if you noticed this. The A team is on wonderful things to get together and learn a little bit more and we've got this lunch. And we'll have some parting words from Mike.
All right, thanks. Well, again, thank everybody for coming. I certainly appreciate it. The VCAT is in your community. VCAT stands for Veteran Community Action Team. Today, action. This is what we do. Too many times in the past, there have been service organizations and veterans that need their help and just no conduit for getting them back and forth. And that's what the Veteran Community Action Team does. If you want to be a part of the Veteran Community Action Team, on the bottom of your agenda is my email address. If you didn't get a chance to get one of my cards, please email me and I'll share more information about the VCAT and get you involved. Also on the bottom of your agenda is a little save the date. The next our next healthcare subcommittee event is on August 24th to discuss opioid reduction. As you know, veterans suffer from that just as much as the community does. So we're going to have an event August 24th. If you'd like to be a part of that, again, I have your email address. I will send you an invitation to that when the time comes to set aside August 24th to come join us again. If there's any questions for the panel, myself, Ann, or anybody in the room, we'll stick around for a few minutes. If you have something to share with the group, or just.
What day of the week is the 24th, do you know?
Now you stump me.
I know they can pull the calendar up on their.
Somebody with a smartphone, throw it out there, would you? I think it's Thursday, yeah. So Thursday.
Thursday?
I guess
Or
it's Thursday.
Tuesday.
Or it's Tuesday.
Or-
Someone's looking, somebody will look. Before this guy leaves, make sure he knows what day on the 24th. Okay, with that, we'll stick around.
Thank you.
Thursday.
For the people who we signed in, they should add their email address if they want.
Yes, if you signed in and didn't add your email address, please stop at the registration table and add your email address to that list so we can send you out information. Thank you again for coming. Hope you enjoyed lunch. We'll look forward to seeing you on August 20th.